bureaucratic hoops to jump through. We must listen to our researchers and deal with the problems they face, so we can ensure scientific endeavour leads to new solutions for our NHS and economic growth. Moving on, as our health paper explains at length, here in Scotland, we would adopt medical technology solutions at scale to manage patient care, shorten hospital stays, reduce hospital readmission rates, improve patient satisfaction, and achieve better patient outcomes. Our modern NHS would embrace innovation and introduce the latest medical equipment. In rural and remote areas, this would include mobile screening services. Instead of expecting patients to travel long distance, we would take diagnostics to the community, such as lung screening. AI can screen X-rays, CTs and MRI scans to speed up diagnosis, to complement, not replace doctors. We would strengthen primary care so practices can handle the volume of demand and the kind of clinical interventions that are safe and practical to deliver in the community. This includes providing credible backing for community pharmacies, optometrists, audiology services, physios, link workers who have the expertise to support community-based care. To achieve this, we would reprioritise resource. In plain speak, we would fund the necessary changes. But to get there, we must have a concerted focus on reducing inefficiencies. We would use data science and AI to be more efficient, from handling surgery schedules, managing staff rotas, ordering equipment and consumables. We would also ensure that NHS management better supports frontline clinical staff. Turning to staff terms and conditions, these must work for those on the front line and their families. Good staff morale is vital, and this is how we retain great people and make the NHS an attractive option for our bright school leavers. We must allow a greater number of suitably and qualified young Scots to enter our profession and provide incentives so we can empower rural healthcare. Our ambition should not be stymied by arbitrary caps on student numbers. Of course, sound healthcare economics is vital, and I support incentivising preventative healthcare, as this is good for patients, but also cost-effective. Scotland's NHS must also be geared up to deliver at the local level, closer to the people. Local delivery needs strong primary care, supported by IT and health data, testing in the community, and this is really important, bespoke services for Scotland's rural and remote communities. I'm acutely aware that central belt solutions for primary care won't work for the whole of Scotland. Across Scotland, our vision of a modern, efficient, local NHS would underpin strategies and action plans. We continue to develop a raft of joined-up policies that will support this vision of a reformed Scottish NHS. A vision Scotland wants and Scotland deserves. And with that, I'd like to hand over to the Scottish Conservative leader, Douglas Ross, to formally launch our health paper, our contribution to a national conversation on the future of Scotland's NHS. Thank you.
Well, good morning, everyone, and thank you, Sandesh, for that introduction. And can I say how good it is to see many people in the room today who have been instrumental in helping us shape the paper that we are launching today. I am extremely grateful for your input, and I know we will continue these discussions on this paper, on future papers in the weeks, months and years ahead. And as Sandesh says, it's really fitting that we're here today to launch this paper. Close by, we've got the Royal Infirmary of Edinburgh, one of the oldest hospitals in Scotland. It dates back to 1729 and is a testimony of the long history of healthcare in Scotland that reaches far back beyond the creation of the National Health Service. And we also have the Edinburgh Bioquarter that we're also in today. And this employs 8,000 people developing cutting-edge medical research that will change the future of how we treat patients, not just here in Scotland, but around the world. And often, this is the part of healthcare that we don't talk enough about. its future. We look with fondness at our National Health Service proud history of providing healthcare free at the point of need since 1948, and the important role that it's played in all of our lives. But we do not speak enough, not nearly enough, about how our health service will continue to be able to deliver free healthcare when it's 100 years old in 2048 and beyond. We can all see the cracks in the system that is well past breaking point. Despite the best efforts of incredible, hard-working staff, 1 in 7 Scots, 800,000 Scots, are on an NHS waiting list. Performance in A&E, cancer, mental health and delayed discharge have all hit record lows in recent years, and more staff are now leaving the service than joining it. Our health service is in a permanent crisis, yet the SNP government offer no vision to turn around the fortunes of our NHS. Humza Yousaf was the architect of a flimsy recovery plan that has seen standards fall across the health service since the COVID pandemic not get better. By his own admission, he was winging it while he was in charge of running Scotland's NHS. And for months, he defended a disgraced health secretary who was more interested in saving his own job than saving the NHS. Now, Michael Matheson may have resigned, but there are still serious questions for Humza Yousaf to answer on this issue, such as why did he allow Michael Matheson to remain in post for months during a winter NHS crisis? Why did Michael Matheson decide to resign before he'd even seen the report into what he had done? And will this report now be published in full? I believe absolutely it should be, and it must be. But beyond this recent scandal, over 17 years of SNP government, the problems in our NHS have mounted up. Burnt-out staff, lengthening patient waits, and recruitment and retention, to name just a few. Yet the government have time and time again failed to realise that for many of these challenges, more money is not the only answer. It's not good enough to blame Westminster for the state of Scotland's NHS. The big challenges facing our health service are the SNP's responsibility and won't be resolved simply by more funding. Because firstly, we will run out of money. And from the SNP government's perspective, they've already hit that point. The IFS have said that health spending in Scotland is due to fall in real terms next year, and major capital works like hospital upgrades have been paused for the next 2 years. Let us be very clear. Cutting health spending in Scotland is a political choice made by the SNP. And stopping the NHS from investing for its future is short-termism in the extreme. But over the longer term, the Scottish Fiscal Commission estimate that by 2027, funding for healthcare will take up 35% of the devolved spending. And 50 years from now, it will take up half of the Scottish Government's budget. With an ageing population, increasingly complex healthcare needs and a rising cost of treatment, demand in our health service will only continue to spiral far beyond our country's ability to pay for it. We can raise our growth rates and bring in more revenue through taxes, through taxation. As my party have said, we need to grow the economy to get that money coming in for public services, and we will always argue that. However, that can only realistically go so far. We can't solely spend our way out of this health crisis. We need to be prepared to improve and adapt to face the big health challenges that we are seeing today. To look beyond the system that was already on its knees before the pandemic and which has seen COVID deliver a crippling blow. To use innovation and data to permanently upscale capacity. To ensure staff working practices are as efficient as possible. To create a health service that can handle seasonal variation, that is not thrown from emergency to crisis every winter. Yet this again can only go so far. We can all hope that technology will offer the miracle drug to treat all the ills of the NHS. But policymakers cannot rely on that being the case. And while we can increase efficiency and staffing through better recruitment and retention and a reduction in agency work, many staff are struggling and considering their future in the healthcare system. So in addition to raising capacity within our healthcare system, we need to look at the other side of the coin, at demand. All of us have and will continue to use our National Health Service. It looks after us in the first moments of life and in our final moments of life. It cares for our children and our grandchildren, our parents and our grandparents. All of us have a stake in ensuring that it's there for us and our loved ones when we need it most. And we all collectively pay for it. So it's right that we also have that responsibility for its continued effectiveness, to ensure that it's not overwhelmed. That must mean that we have a role ourselves in reducing demand. Now that doesn't mean avoiding going to see a GP or to A&E when there's a need to do so, but it does mean making healthier choices. Scotland is one of the most unhealthy nations in Europe. We have a lower life expectancy than any other nation or region of the United Kingdom. More than a quarter of all deaths in 2022 in Scotland were due to preventable diseases. Since 2014, healthy life expectancy has fallen, and Scots are now expected to spend 2 fewer years in good health than their counterparts in the rest of the United Kingdom. Within our nation, the figures are even more stark. The most deprived Scots are living twice as long in ill health than those from the least deprived backgrounds. Not only is all of this devastating for individuals and families who have to face years and years of living in pain or caring for loved ones in pain, but it also puts pressure on our social care system and our NHS that they can no longer cope with. If we want to build a more sustainable health service, then we all need to start making healthier choices. We need to move on from narrowly thinking in terms of delivering what Reform Scotland calls a national illness service and start building a truly national health service. That's why we framed the paper that we're launching today around the need to build a new contract between Scotland's NHS and the public. Because we all have a shared interest in the future of our health system. During the pandemic, one of the greatest motivations of compliance with the rules at the time was to protect the NHS. Families across the country drew rainbows in their windows and clapped for healthcare workers. The public's appreciation for our health service is boundless. Yet in order for the service to continue to survive, we must channel that appreciation into strong public health messaging on the need for personal responsibility in healthcare. And the health service we build must be one that's focused heavily on prevention. Today we spend just 2p on public health and protection for every £1 we spend on frontline healthcare. Yet it is significantly more cost effective to stop a person getting ill in the first place than it is to treat a patient. If the NHS is to recover, then part of the responsibility has to be placed on the public to better care for ourselves. Reducing the numbers of avoidable health conditions in our population would take a sizable number of patients out of treatment waiting times. It would significantly reduce demand. So our first priority would be to redouble the efforts to tackle the big preventable killers in Scotland. Over 8,000 Scots die every year from smoking, and 1 in 9 Scots are smokers. Yet while smoking rates have decreased, more than 1 in 25 S4 pupils are regular smokers, and 1 in 10 regularly use a vape. Underage smoking continues to be a problem, and underage vaping is rising rapidly. We need to tackle the blight in our schools, in our high streets, and in our communities. That's why I welcome the announcements that have been made by the UK Government to create a smoke-free generation and to stop vapes from being marketed to children. But we would go even further to tackle underage vaping. We would introduce a vaping restrictions bill to bring a law on vaping into line with a law on smoking, banning its use in public places. Our law would also increase the fines on the sale of tobacco and vape products to under 18s and force vape products to be sold behind the counter. This would help not just tackle one of Scotland's biggest killers, but also crack down on the preying tactics of manufacturers and some shops who profit from children. Another public health emergency is alcohol and drug addiction. Scotland has, and has for many years, had the highest drug rate anywhere in Europe, and the highest alcohol death rate in the United Kingdom. Over the last decade, we've seen alcohol and drug deaths increase, while the SNP government have reduced funding for recovery services year after year. This is a shameful way to treat some of the most vulnerable people in society, but it's also led to substantial increased costs to our NHS. That's why I'm in the final stages of being ready to present the Right to Recovery Bill that I'm bringing forward to the Scottish Parliament, and we will lay in front of MSPs later this year. This landmark legislation will give those struggling with addiction access to the recovery services they need, they want, they deserve to overcome their struggles. Obesity is also a continued problem in Scotland, with our nation having higher rates than the rest of the United Kingdom. It's costing our NHS £600 million every year. That's why we need to communicate strongly the benefit of making healthier choices, to say loudly that it's never too late to take action to improve, and to make those choices as easy as possible, especially during the cost of living crisis, by reducing the cost of taking part in sport or buying healthy food. This would be an important start in how we help to deliver a healthier population that is living longer and better in Scotland. Yet it would also reduce the pressures on the NHS, allowing it to reduce waiting times across the service. And that's an important aspect on how we sell public health prevention to the public. Government needs to deliver on its promise that it offers a better health service to be there when we need it most, and that starts by delivering a responsive health service with more capacity. Now, part of that will be the most common way that people interact with the health service, through GP appointments. Yet the share of the budget allocated to GP services has declined. We've seen 86 local medical facilities being closed since 2012 as part of a centralisation agenda. As a bare minimum, people expect to be able to see a GP in a manner that is convenient to them. That's why we would increase the proportion of NHS funding being given to GP services. This would enable us to recruit 1,000 additional GPs across Scotland. We'd also introduce a ban on local health closures for reopening practices to ensure there are no black spots across the country. We'd make appointments as accessible as possible by offering online booking and consultations, and introduce a new national standard of 1 week for waits for a GP appointment, so that the unacceptable waits that we have seen become a thing of the past. Taken together, our GP guarantee would reduce pressures in our A&E departments by restoring confidence in local health services. Yet, raising capacity cannot just come from increased investment in services. We need to look at making the NHS more efficient. In our paper, we look at how we can save money through better workforce planning to reduce the £500 million of agency staff bills, cutting the size of bureaucracy by reducing the number of boards and making it easier to sack underperforming senior management, or better working practices, which will be vital to make sure that we make best use of existing operating theatres and staff. However, the most important way that the NHS can improve efficiency and handle larger patient numbers is by increasing the use of technology. Increasing the availability of online bookings and video consultations could be a game changer in reducing the volume of calls coming into the NHS. To better facilitate this and to give patients more responsibility in helping to manage capacity within the NHS, we would create a My NHS Scotland app. This would allow patients to view live-time hospital A&E waiting times to get seen faster. However, an even bigger way that we can use technology to drive forward efficiency in healthcare is through digitalising medical records. It's currently the case that patients don't have easy access to their own medical data. In many cases, records are stored in physical copy and transferred by road across the health service, leading to delays in accessing them and unnecessary costs. In 2014, it is beyond incredible that all medical records are not stored and accessible on a digital platform. We are running an analogue health service in a digital age, so we would digitalise all records to make them easily accessible to both staff and patients, while also giving patients control over consent for those records to be shared across the wider health and social care sector. This change would improve patient data available to the NHS and reduce bureaucracy. It would also empower patients by giving them access to and control over their own medical records. It's an important change and one that is long overdue. Now, I'm not going to pretend that we have one silver bullet that can make our NHS more efficient for patients, less stressful for staff and more affordable for taxpayers. However, in the policies in the paper we're launching today, just a handful of which I've mentioned in my speech, they can make a real difference in reducing demand and increasing capacity within our health service. And at the heart of any approach to protect our NHS for the future must be a new focus on personal responsibility. The public must work hand in glove with our health service to make prevention the core of how we tackle illness in Scotland today and tomorrow. The more we understand our role in protecting our own health and, as a consequence, the health of our NHS, the more we can free up resources to allow the health service to modernise and make the improvement it needs for the future, so that it is available to all of us and our loved ones when we need it most. We will all rely on our health service at points in our life, but our health service relies on us every day to make the right decisions and the right choices so that we do not overwhelm the system. During the pandemic, despite the difficulties and pain it caused, the public made the right choices to help the NHS through that crisis. The changes I'm talking about today are nowhere near as wide-ranging, but they are just as necessary for the good health of our NHS. We all need to make the right choices to get our NHS through this crisis that it's facing today and to protect the NHS for the future. An NHS that is modern, efficient and local. Let's build a new social contract between Scotland's NHS and the public. Let's all support the health service in its time of crisis, so that in our time of need, we all receive the prompt treatment we deserve. Thank you all very much. Now, with that, I'm happy to take any questions. I know the press may have some questions, or we'll do a huddle afterwards, but if anyone has got any questions on what Sandesh and I have announced today, what's in the paper, happy to take them. Yes?
Chris Carr from Edinburgh University Business School. As a business professor, I'm very keen to see organisations and companies actually engage with that as well, and to do more for their senior or more elderly staff, perhaps approaching retirement, the 50-pluses. And I'd like to say thank you to Sandesh actually for putting us in touch with the British Society for Lifestyle Medicine at Paddington. And right now we are looking, if there's anyone out there, for companies and organisations that would want to work with us. We've scanned the field, and there's an awful lot of evening classes out there, but we'd like to see people reorientated towards really professional, preventative, personal choice medicine, and recognising that they can extend that 30-year after retirement period healthily with kind of short, sharp programs. And so would that fit with this sort of picture? And if there are any organisations out there, we are looking right now for a pilot. So What do you think?
Well, an excellent pitch, and if there are any, I think they'll be signed up after that. Yesterday, after First Minister's questions, I was involved in a cross-party reception with Age Scotland and MSPs from across the political spectrum, looking at loneliness and isolation, and particularly that period in the immediate lead up to retirement and immediately after retirement. And there's an awful lot more we can do to help people in that period. So I think it fits in exactly with what we're speaking about here. This ability to help each other, to help keep down that burden on the NHS. We all know it's under strain at the moment, so anything we can do as individuals, as businesses, as sectors to help with that, I think is absolutely crucial. And that's part of the conversation we're starting today. I think we've got to look at the NHS, as I said, looking at the future as much as the past, and looking at the demand and how we can all take part in reducing that demand going forward. So thank you for that. Anyone else? Yes, sorry.
How would you ensure that NHS dentistry is fit for the 21st century and change the focus from drill and fill to preventing disease?
Yeah, that's exactly the words we use in the report, if I can get to it quickly enough in here. But I think it's a crucial area. Obviously, we had the UK government launching their new dental health strategy earlier on this week. As I say, the wording is almost exactly what you would say. If you go to page 21 of the report, you'll see that many practices are unsustainable and will not continue. That's a real concern at the moment. So in my local area in Murray, we have no ability for people to get onto NHS dentist lists at all. So people are being told to go to NHS other areas in Grampian, such as Aberdeen. They go to Aberdeen and the lists are just as full through there. I've got a case ongoing at the moment in my constituency where people want to start up a new dental surgery, but they're coming under pressure from NHS Grampian and health planning standards that make it financially unviable. They're looking at an extra £500,000 to meet conditions which will prevent them from being able to open up that business that would see hundreds of additional patients being able to be seen. But what we would say is, and it's detailed here, we want to prioritise a root and branch reform of the statement of dental remuneration. So dentistry is financially viable and it's based on delivering holistic, modern, best practice services and on prevention, holistic oral health care, rather than a fee per item and drill and fill culture. So hopefully, maybe that was your wording that got inserted into there, but it's certainly in there. It's an important area, and how good dental health can spot things early, like oral cancers and such like. It's absolutely vital that people have the ability to see a dentist, to again look at that preventative model that we are approaching and advocating today to reduce the problems further down the line. I was impressed I managed to find that so quickly, actually. So, yes.
We want to invest more in Scotland. We're a European company centralised out of Poland, but we want to collaborate with the NHS more, and it's challenging for us. Do you have a kind of idea of how best to do this in the future, or in your vision, how we can do it and collaborate and invest more funding in terms of infrastructure, but also staffing? We'll be employing staff as well.
Yeah. Well, I think, first of all, that discussion and conversation is vital. Sandesh and our health team have done a lot of work with this paper, but I'm very proud to say a lot of it's come from listening to individuals, to sectors, to people in this room. And that's how you formulate good policy. You don't say that your party is the only one that's got all the answers and you close your ears to any other suggestions. So that engagement, as I said right at the beginning, has been crucial and will be crucial going forward. We have a new Health Secretary in his first day in the job. I wish Neil Gray all the very best in that important role he now has. But it will be crucial that the Scottish Government are open to suggestions, look at where there is legitimate criticism to what they have done or are not doing, and be willing to engage widely with how we improve our NHS, where you're investing, where others are investing. And as Sandesh says, there is not a one-size-fits-all model. My region of the Highlands and Islands is very different to his region in Glasgow, and that's why we've got to look at local local solutions as well. So it's modern, efficient and local, and I think those words will ring true with people who are looking to the future of their health service here in Scotland. Anyone else? Yes.
Hi, Sarah Scott from Community Pharmacy Scotland. When you're talking about I am a pharmacist myself, as well as working for the organisation, and I'm just wondering how it's going to support the access to digital patient records to help support community pharmacy to be able to deliver nutrition to their customers. I'm an independent prescriber in community pharmacy myself, and we're finding more and more patients are coming in looking to be treated for common clinical conditions, which is great. That's part of delivering a sustainable NHS, but we still don't have access to medical records, and as a result, sometimes we're having to put patients back into GP practices for assessment because we don't have access to those really important records to ensure patient safety.
I agree absolutely 100%, Sarah, and I think almost the public find it incredible that, you know, in 2024 they can't go into the pharmacists and expect their pharmacists to have access to their medical records. So not only is it that you know, modern system that people, I think, understandably would expect and are right to expect, there are dangers and problems with it not being digitalised. I spoke about the cost of moving physical records. I had an example in my local hospital at Dr Gray's at the end of last year or very early on this year, where medical records were destroyed because there was flooding, there was sewage came in, and those records had to, you know, someone had to work through that to then get them back up to a standard that they could be used. If that had all been digitalised, that would not be a problem. So it's making sure they're available to GPs, to pharmacists, to others, and to give patients that ownership of their own medical records, to allow them to be easily shared within the NHS and the health and social care system as well. I think it is long overdue and something that I think was really important to get into this report. And again, I would say, with a new Health Secretary, day one in the job, I'm not precious about these ideas. These have been brought forward as a Scottish Conservative paper that we're launching today. But if Neil Gray and the Scottish Government want to take on these policies, they can do them now. Many of them could be implemented very, very quickly. So listen to what we've listened to, hear from the same experiences, look at what we are recommending in this report, and it could start to make an immediate beneficial change for people working in the healthcare system, but importantly for those who need it. Any others? No, well, could I just thank you all again for coming today. This is the second in our series of papers that we are launching. We've done one last year on growing the economy, which also fits into what we're discussing today. With a growing economy, we can have more resources to spend in our vital public services. Today's one on health has been built with a lot of support from people within this room. We have further reports in education and rural injustice coming up, and I think it's vitally important that we have this debate in Scotland, that we look at the services that are delivered in Scotland, the policies that can be debated and decided in the Scottish Parliament, and this is a start from the Scottish Conservatives on developing that conversation about improving our health service, but also protecting it now and into the future. So thank you all very much for coming here today.